We're going to start today's episode by talking about a range of common children's health issues. To do this, I'm thrilled to be joined by Dr. Yan Yan Wu. Dr. Wu is a GP who looks after people across all age groups, and she has an interest in children's health. Thank you so much for joining me today, Dr. Wu.
Thank you very much for having me today.
Now, as a paediatrician, chatting about children's health is obviously a key passion of mine. So I wanted to ask you about a range of different conditions we see in kids that you would see all the time as a GP. Okay, so asthma. Now, many parents have heard about asthma, but what is it and who gets it?
Yes, so it's a very common condition in both children and adults. So essentially, it's the airway getting a little bit irritated by whatever irritates the airway in the environment. So when the airway gets a bit irritated, it tends to spasm and it gets narrower than usual. So then it becomes difficult for the people to breathe. So in children, we commonly see them having a wheezing sound, or they find it difficult to breathe. They may feel the chest is a bit tight if they are old enough to tell you.
So what are some of the treatment options available for children with asthma?
Okay, it really depends on how bad the asthma is. So most commonly we'll be using asthma puffers. So that's inhaled medications which children can inhale. So there are two different types of inhalers. We call them preventers and relievers. So relievers mean that they relieve the symptoms very quickly, and the preventers mean that they can prevent the asthma attacks from happening. So relievers is when people use when they have asthma attacks. So they will need to inhale the medication, which will help the airway muscle to relax. By doing that, they will feel much easier to breathe. Occasionally, children may need to take some other medications, such as the tablets they need to take every day to prevent asthma attacks from happening.
Okay, so lots of different treatment options out there. I guess the main rule for parents is have a chat to your GP, because GPs know lots about different medications that are available for asthma. Thank you. Now I'm going to move on to viruses. I'm guessing you see a lot of viruses in your work as a GP. Viruses are infections that are incredibly common, particularly in preschool age children. What are some of the common symptoms that you see in children who have viruses?
I guess the most common symptoms would be respiratory tract infections. By that, we mean runny nose, a sore throat, a sneezing, blocked nose. That's very common. And also, children are more likely, compared to adults, to have middle ear infection from the upper respiratory tract infection as well. So they may have a sore ear, they will be pulling their ears, and they may have a fever as well. And it is also very common for children to have a rash when they contract a viral infection.
And I'm sure that you see a lot of parents who are wondering about antibiotics for viral illnesses. What's your message around that?
Yeah, that's a very good question as well. So I get asked that question asked a lot. So essentially, antibiotics don't really work for viral infections. So it doesn't really help the children to feel better soon. But it has the risk of causing side effects. And some of the common side effects include nausea, vomiting, diarrhea, which are not pleasant at all. And if we repeatedly use antibiotics for viral infection, it can also help the sort of superbug develop down the track. So when the child does contract a bacterial infection for which they will need antibiotics for, then the antibiotics won't work.
Great advice for parents who are seeking antibiotics for viruses. Now, I want to ask you, what can parents do at home if they've been told that their child has a virus? Do you have any tips?
Yes, so that depends on what sort of viral infection we're talking about. So if we're talking about a respiratory tract infection where the child has sneezing, blocked nose, sore throat, things like that, then to provide them good rest and enough hydration are the most important things that the parents can do. When they have headache or fever or sore ears, then parents can give them some simple painkillers like a Panadol or Nurofen. Usually that will work the wonder.
That is great advice for parents who are battling a virus at home. Now, you touched on dehydration, so I'd love to chat about that next. I'm a paediatrician and I see a lot of children admitted into hospital with dehydration. And as a GP, you probably see the kids who are well enough to be at home with dehydration. What is the advice that you give these families to try and keep kids out of hospital and keep them hydrated at home?
Yes, so usually I would say to the parents just to give them whatever fluid they are happy to drink. So dehydration usually happens when children have gastroenteritis. So they may be vomiting, they may be having really bad diarrhea, and they really struggle to keep things down. And they will refuse their usual food. So I will ask the parents to give them water to start with, and they can have diluted juice as well, and they can have hydrolyte. So they can buy hydrolyte from the chemist, and there's isopor option as well, which children would love to lick on. And I think for little kids, it's very important to offer them the fluid very frequently, just every 10 to 15 minutes, even just a tablespoon of water, that would be fantastic. At the same time, I'll also ask the parents to monitor the output of the children, especially for little kids. So are they making good number of wet nappies? Are they having dirty nappies? And when they cry, do they have tears? Things like that.
Oh, all fantastic advice. So small, frequent amounts of fluids and keeping an eye on the urine output. I love it. Now let's chat about fever. So fever is a temperature above 38 degrees, and I know that it's something that parents get very worried about. My general advice is we're not very concerned about the actual number of the fever. What's more important is what's causing the fever and what the symptoms are. What is your general advice to parents about what can cause a fever and what sort of things to look out for?
I guess the most common reason that we see for fever would be some kind of infection. Then for kids, we usually would start asking ourselves, okay, whether this kid is having really bad infection or not. So we think about their airways, we think about their gut, and we think about their bladder. Those are the common things. So then if we think, okay, that the kid has a really bad infection, then we would treat them very carefully. But I think in general, parents should be watching out for the mental status of the kid. So whether they are alert, they are awake, they are happy, they are interactive, or they are so lethargic, can't be waken up, and also whether they have the energy to play around. I think those are the important things. And another thing that I would ask parents to keep an eye on is whether the kid is developing rash, and also how long the fever has been lasting for, whether Panadol or Nurofen can really bring the temperature down. If they are worried at any point, then they should really bring the kids to see a doctor.
Fantastic. So great advice there again. I guess the main thing to note really is that fever can be caused by lots of different things, isn't it? So your common cold virus can also cause fever, as can a more severe bacterial infection. So as you mentioned, the key is always get your child seen if you're worried about a fever and you're looking for some of those more serious signs that you discussed. Thank you so much for going into that. And then finally, let's chat about eczema. Now, eczema is a really common skin condition which causes dryness of the skin and can sometimes cause infection. What can parents do on a day-to-day basis to just manage the general health of their children's skin?
Yeah, so I think the most important thing is to keep the skin moisturized to avoid the dryness of the skin. Because when the skin gets dry, then the skin barrier would not be working 100%, then people tend to get the eczema or other skin conditions. So I would say moisturizer is the most important thing to do. So usually for little kids, you may want to do moisturizer from head to toe twice a day. And for little kids with eczema, you may want to do that 4 times a day. And we would like to choose moisturizer without plants or food or animal product, because those things are more likely to cause irritation of the skin. And I think another sort of misconception is that people think that it's the water which keeps our skin moisturized, but it's actually the oil, the skin oil is doing the job. So then if we wash ourselves too vigorously, then we remove all the skin oil and our skin will get dry. So I would say when we have a shower or bath, just lukewarm water, brief wash with non-soap wash.
Fantastic advice. Thank you so much. We've covered a lot of information just then for parents, and I really appreciate you taking the time to join me today.
It's really my pleasure to talk about kids stuff.
Thank you so much, Dr. Wu.
Thank you, Nelu.
Now I'm very excited to be joined by Dr. Khanal. Dr. Khanal is a paediatric doctor who has worked across multiple hospitals and clinics. She enjoys working with families of different backgrounds, listening to their stories and supporting children to thrive. And today she's here to talk to me about some really important messages relating to children's health. Dr. Khanal, it is an absolute pleasure to have you.
Thanks so much for having me, Nelu. Such a joy to be a part of your show.
Now, firstly, let's chat about a topic that I'm personally very passionate about, immunisations. Can you please talk to our viewers about what exactly immunisations are and how they work?
So probably a simple way to think about it is immunisations are a very weakened or inactive form of a virus or a bug that we expose ourselves to so that our body can have a reaction before actually getting the real illness. It's like training your body so that you can be slowly exposed to the inactive or not so real thing so that when the real thing comes, you're very strong and prepared to deal with it much better than you would have otherwise.
Oh, that's a fantastic way to think about it. Why is that important though? Why do we need immunisations?
If you can imagine, there's so many bugs, viruses, bacteria, so many things out there that can be really quite devastating to our young people and also to adults. And over the years, we've seen lots of different illnesses come and go. And the more prepared we are to be able to face it, it actually means that, kids don't get as sick and adults don't get as sick. And we come out of it with just a few sniffles rather than being in the ICU in the hospital. So it really decreases how severe illnesses are, or means that we don't get sick at all for some of the illnesses. And, we know things like polio and other illnesses that used to be so scary and actually took so many lives, actually, really not that significant anymore because of vaccinations.
Right. So it sounds like there's lots of benefits to the vaccinations. I know that there is a bit of concern out there in the community about side effects of vaccinations. Can you talk us through some of them, please?
Yeah, absolutely. I think concerns that parents and people have around side effects of anything is actually really good, and it's very healthy and helpful to have these conversations. Some of the simple side effects we can see is, at the injection site, you can get a bit of a local reaction. It's not very common, but it can be a little bit uncomfortable. Low-grade temperatures, particularly to some vaccinations, can be quite common as well. But again, like I said, you're having a mild reaction to the not-so-real thing so that if the real thing comes along, you don't get as sick. And then allergies, no matter what medications you're having, you can have allergies. Again, not very common at all. And which is why, kids and adults are monitored for a bit of time once the vaccinations are given so that, the risk of the main reaction can be monitored in a safe place.
And who can parents speak to if they have concerns about whether their child is safe enough to have a vaccine or if they're worried about side effects?
I think your GP is a fabulous resource about any questions around vaccination, and they have so many helpful information packs or resources for specific vaccinations depending on how old your child is, because as you can imagine, each age group will have a slightly different vaccination. Maternal child health nurses can also provide some information if you have easy access and are seeing them anyway. And then there are vaccination clinics around the state that your GP can refer you to, but often they're drop-in services that you can drop in and have a chat to some very highly qualified immunisation nurses who do it day in and out and can provide you with a lot of information.
Fantastic. So lots of resources for parents to turn to if they've got questions. It sounds like overall the overwhelming benefit of immunisations is a big thing that we need to think about, which is why the government does fund free vaccinations for children. There are some that aren't on the schedule though. So for example, the flu vaccination or the COVID vaccinations that aren't sort of in the mandatory schedule that we see in children. Are these still important?
Yes, absolutely. And I'm not just saying that, but I've just lived through a very, very busy flu season at a public hospital in Victoria where we've witnessed some really, really significant, we think of the flu as being just the flu. It's not just the flu. If you get, influenza, it can be really, really quite significant, and we've seen kids land up in the ICU with the flu, so it can actually be quite dangerous, and easily, the severity of illness can easily be minimised with the vaccine. So I still think it's quite important, and I know, it sometimes feels like it's semi-optional because we have to do it every year, but in a way, seeing how sick kids can get with it, I don't think it shouldn't be. And I think between 0 to 5 years of age, I think it is covered. So I know the older kids are not covered by Medicare to get the vaccinations, but for the younger kiddies, where the risk is even higher, it will be covered by the government. So please get it every year. It's really important.
Yeah, I'm glad you mentioned that. I have also been working in the hospitals through this flu season, and it has really been devastating for some children. So I'm glad that we're getting that messaging out. Now, we've spoken a bit about immunisations being a great way to prevent illness in children. Are there other sort of general tips that you can give families about what they can do for general health in children?
I think, living a healthy lifestyle, an active lifestyle is a good, way to, it's almost like preventative healthcare. So making sure, you're running well, you're running up to date, having a good relationship with a GP who knows the child well is so important, because they'll be able to tell when your child is perhaps not doing as well. So, and also, we know that kids take a while to warm up to. So if they've got a good relationship with a doctor, they'll feel comfortable to go and see them. So I think it's completely okay to go and check in with your GP every so often, even though you don't have any specific question. And, eating well, active lifestyle, going to school, kinder, all of those things are so important and good for kids. So doing all of those things.
Yeah, so it sounds like what you're saying is health isn't just about the medical side of things. It's also about nutrition and exercise and relationships and all of that as well. So we see in social media, there's a lot of focus on sort of health foods and superfoods and things like that. Are all of these things important for parents to think about? Because it can be overwhelming as a parent to feel like you're doing the best thing for your child when there's so many different options. What's your approach to that with families?
I think most families know, a healthy, well-balanced diet, being very active. Those are kind of key pillars of a healthy lifestyle. And I think not getting too overwhelmed with, specific brands or products, that's okay. And things are expensive at the moment. I think just trying to make things as varied as possible. And also making sure you're doing the right thing that's culturally appropriate by your background, and doing all of those things are the best you can do for your family. But I think don't, take that pressure off yourself to try and buy the best of all of the things. You don't need to.
So I think that's a great message for parents, to just remind us all that we just need to do the best we can with the resources that we have.
Yep, that's right. Parents do a hard job and they do a good job. So, yeah.
Great messaging there. Thank you so much, Dr. Khanal. It's been an absolute pleasure to have you on the show today. Thank you for sharing your expertise.
Thanks so much. Thanks so much for having me.
Now, the next segment is a bit different. I'm not doing an interview. Instead, I'm going to have a chat to you. Now, I'm Dr. Nelu Simmons. I'm a paediatrician and mother of 3. And obviously, chatting about children's health is my passion. Today, I wanted to focus on introducing food in babies and infants. So, when can you introduce solids to a baby? The recommendation is no earlier than 4 months and usually around 6 months of age. Now, this depends on whether your baby is showing signs of readiness. So that includes good head control and looking interested in food. So while you're eating, you notice that they're really paying attention, or they might open their mouth when you offer food or even reach for your food. So that's a really great time to let them play with safe foods and experiment with different textures and start their introduction journey. In terms of how to introduce foods, every baby and every family is different. You might begin by feeding your baby purees, or with baby-led weaning, which is allowing the baby to feed themselves, or a mix of both. Now, I'm not going to go into that today because it's a huge topic, and you can speak to your maternal child health nurse or GP about it, or if you want more information, you can jump onto the raisingchildren.net.au website for heaps of advice on how to introduce solids. What I would like to chat to you about are some of my key take-home messages around introducing solids. So first things first, I want to go through a few things that are completely normal. Introducing solids is messy business. It often involves food smeared all over the table, all through their hair, on the floor, and it can look like a disaster. And I think that's one thing that really throws parents who aren't expecting it. So just make sure you're expecting the mess. The other thing is it's very up and down. So some days your baby might eat what seems like a lot, and some days nothing at all. And that is completely normal. Expect a messy roller coaster on this journey. Now next, never force feed a baby. Babies like to have a bit of control and they need to learn to listen to their tummy. So when they turn their head away or say no or make it clear they don't want any more food, we do not recommend force feeding. This can lead to what we call oral aversion, which in its worst form means that children stop eating altogether. We're aiming for a calm meal times with no pressure. Seeing you and their siblings eat and enjoy food is how they learn. The next message I want to talk about is milk. Now, breast milk or formula is still the main source of nutrition for infants until 12 months of age, which is why it's okay to go slow and completely at your child's pace with food. After the age of 12 months, we recommend that the main nutrition and calories should be coming from food. So we would advise to give meals first and then breast milk or a bottle after the age of 12 months. And for babies who are formula fed, you can safely start to transition across to cow's milk if that's tolerated. But we strongly recommend giving only up to 500 ml a day, otherwise it can affect their appetite and iron levels, which is very important for energy and growth. So until 12 months, milk is most important, and after 12 months, food is most important. Now let's talk about a few things that concern parents when introducing solids. Constipation. Most kids seem to be more constipated when they start solids. Now, often it's not that they're actually constipated, rather that their little bowels are just getting used to solid food. Imagine you've only ever had a liquid diet forever, and suddenly you start eating solid food again. Of course, your poos are going to be a bit more harder. So while their stools become more formed and solid, it doesn't necessarily mean that they're constipated. But of course, if you're worried, please have a chat to your GP. The next thing is choking. Now, this is something that understandably really worries parents. There are a few ways we can minimize choking in children. So for one, making sure the child is seated and supervised during meal times. We don't advise children walking around or being on their backs during meals. The biggest thing though that you can do is to avoid foods that are known to be a choking risk. So things like whole nuts or pieces of nuts, whole round foods such as grapes, blueberries, marshmallows, larger pieces of meat and sausages, raw vegetables, or bones in fish, for example. So avoiding those foods can be really helpful to avoid choking. And finally, I want to speak about allergy. Now, food allergy can range from swelling in the face and throat to rashes to vomiting. There are a huge range of different types of allergy, and preventallergies.org.au is a fantastic resource if you'd like to read up on it before introducing solids. The single most important thing I wanted to mention today is that early introduction to allergenic foods can prevent your child from developing allergies. There is a lot of research to show this. So from the age of 6 to 12 months, we strongly recommend that you introduce all allergenic foods to your child. So this includes wheat, egg, dairy, peanuts, all the tree nuts, seafood, soy, and sesame. The more allergenic foods that are introduced prior to the age of 12 months, the better in the long run. So lots to think about there, but I hope some of this has been helpful for you, and stay tuned for more children's health topics coming up. Thank you for watching A Healthy State. I hope you found the information in this episode helpful. This episode plus the rest of the series can be streamed on CTV+. I'm Dr. Nelu Simmons, and I'll see you next time.